Going to check in with the friends over at MyCare Medical this morning, where they are celebrating Hispanic Heritage Month. And joining us today, we have Dr. Lebron-Perez. So happy to have you here. Good morning, doctor.
Good morning.
Yeah, so it's interesting. We're going to talk about Hispanic Heritage Month and in particular, diabetes, which I don't think I realized you were telling me before we got started is pretty prominent in the Hispanic community.
Yeah, the Hispanic community have a really big chance of being diabetic. We're up to 18% more chances of being diabetic than anybody else. In small groups, it can be up to twice the chance of being diabetic. We're talking about diabetic type 2. So it's a really high incidence, and we have to be really aware of this, and it's really important for us.
Wow. So why is that? Kind of explain. And then, obviously, there must be some good news, too, to where we can maybe hopefully prevent some of this as well.
Yeah, we got three major reasons. The first one is going to be genetics. Everybody have a mom, a dad, grandpa, grandma who may have diabetes, or we know they have diabetes, so we have a high chance of getting it. Also, it's going to be our culture, with the way we eat, the way we like to do things, alcohol consumption, carbohydrate consumption. And the last one is going to be physical activity, exercise, of lack of exercise, that we need to work on that as a community.
So what is your advice for people watching this morning? And again, the good news is some of this is, I don't know if reversible is the right word, but certainly there is good news where we can maybe get this under control. You mentioned a little bit of it just with the, your chances increasing. But what would you want to tell people this morning, doctor?
First thing is going to be screening. We have to be aware of what the symptoms. A patient that is eating a lot, a patient that is drinking a lot of water, a patient that is going to the bathroom to urinate a lot. Those are the ones that need to have like a red flag to evaluate them. Primary care, that's what we do. We verify the patient. We got the patient family history. Plus, we also work on doing testing to figure out if the patient is diabetic or not. Now we're trying to work more on the pre-diabetic, trying to find this sooner so we can start working on these patients. Usually diet, low carbohydrates, small portions, multiple meals a day, a lot of physical activity, controlling the alcohol consumptions. All these are the tools to work on this. If the patient is diabetic, we're gonna be working about treatment, diet, compliance with medication, and compliance with the office visit. We need to follow through these patients to avoid kidney problems and eye problems.
You know what I love about the team there at MyCare Medical, and I've had a chance to interview several of the doctors there. It just really seems like this is your passion to make sure, that it almost feels like people are just more than patients, that you really are listening. That's why I love that we're celebrating kind of Hispanic, Heritage Month, because really listening to people's different cultures and kind of their backgrounds and getting to know who they are, why they are, how they are. It just seems like that's a big component, I think, of the team at MyCare Medical.
Communication, different cultures, that's what we're trying to work on. The patient feels that we try to treat all our patients like family. That's our main goal. We want to develop a plan of action for every patient in particular. We want to be there with them, going through all the conditions and giving them the best care that we can do. And it's just about trust. They become our friends. They work with us and everything. If they understand what's going on, they can be part of the treatment, and they can be part of the end goal, which is to improve the patient condition.
I know, again, your passion is for the Hispanic community as well. You have a message for those Spanish speaking that might be joining us this morning, doctor. Go ahead and do that as well.
Seguro. Felicidades a toda la comunidad hispana. Estamos en nuestro mes celebrando. Importante la diabetes para todos. Recuerden lo que estamos comiendo, lo que estamos haciendo, hacer ejercicio, utilizar nuestros medicamentos como se nos prescribe, ir al doctor, nos falta las citas. Es bien importante que estemos bien pendientes a todos. Felicidades y disfrutemos nuestro mes.
Well, doctor, again, I'm just always so impressed with the team at MyCare Medical Group. Certainly there's locations all over the Bay Area. There is the website. There is the number to call for more information as well. But doctor, we know how busy you and the team are, so we appreciate you joining us this morning.
Thank you. Good day.